In the time frame of 20 years, certainly we're going to be completely digital in everything we do in healthcare. We can't do the hands-on treatment component digitally, but everything that supports that will be available digitally, including decision support and a whole bunch of other things. So I think the other aspect of this that's very interesting is the patients will have access to their data. So you haven't probably heard the term personal health record too much recently, because that was a concept that groups tried and it didn't quite roll out as smoothly as expected. But what will eventually happen is that, remember, the patient owns that data and owns the right to it. They will eventually demand and expect that that data is aggregated somewhere. If you think of the immensity of data that can be around one person's health record, big data, however, will eventually happen, and will happen, I believe, within 20 years. It'll be there. The downside of some of these EHRs are that people say, you know, it costs more. I've got to install these things. I've got to train. It breaks my cycle. It takes longer. It distracts me away from the patient, and I'm typing in a computer instead of looking at the patient. It tries to take paper records and put them in just transfer them into an electronic format. Many times not the way to go. My answer to that is we're in a transition phase right now, where we have not taken full advantage of the digital media. I think dentistry will grow as a primary care access point, and then referral as appropriate into the healthcare delivery system. I think there will be more blurring between who provides certain types of services. For instance, if dentists want to do, just as an example, Botox, and ENT people say, we want to do third molar extractions, we can't, in dentistry, necessarily bring it all our way and not expand it the other way. Likewise, if there are going to be fluoride treatments in schools for children, or polishings, screening examinations, whatever, we can't, or fluoride varnishes in pediatricians' offices. There's going to be a blurring of this healthcare, the roles in the healthcare team, and I would like to think we're going to look at what makes sense, and if you look at the healthcare delivery system, you think cost, access, and quality. What makes sense from those three perspectives? I would challenge the new people starting that are going to be in this broader healthcare team to say, how can this help me? And demand, so providers need to drive the market. Right now, vendors drive the market frequently in the US. Providers, users need to drive the market and tell the vendors what they need. So vendors are chasing the market rather than providers chasing the vendors. It's backwards now. So I would encourage them to take the approach of they know what they need, and imagine what will help them, and then expect that, demand it from the vendors. And I believe once that's established as a good idea, the vendors will be anxious to jump into that market.